Good evening, you're watching the People's Platform. While Sri Lanka is in the throes of its worst economic crisis yet, we are told that the spread of a sub-variant of Omicron called B05 is being reported. In such a backdrop, how must Sri Lanka now gear itself to address the health challenges and implications that it will face? To discuss this and the ramifications for Sri Lanka and its health system, we invited to tonight's show Professor Indika Karunatilaka. He is the Secretary General of the Asia Pacific Academic Consortium for Public Health. Good evening and welcome, Professor.
Very good evening to you, Sonali.
Professor, my first question to you. We're told of the spread of this Omicron subvariant. Just 3 or 4 days ago, the Ministry of Health issued a press release saying, considering the current COVID-19 disease situation, it is strongly recommended to wear face masks indoors when traveling in public transport and when in public gathering. Now, this press release comes a few months late because we are told of this subvariant of Omicron months ago. And by now, Sri Lankans are used to not wearing the mask, although the more discerning Sri Lankans still continue to practice mask discipline. Speak to us initially about how important it is for us to know and realize that COVID has not gone away. That's the first thing. And also speak to us about the importance of getting ourselves vaccinated, because in order to deal with an economic crisis and a political crisis and a medical crisis and a whole other set of crises, we need to be equipped and alive.
I think very correct, because if you take the current situation with a lot of difficulties and many instances where people might find it very difficult to adhere to even to certain basic guidelines, and even the health system is facing a lot of challenges, health workers are facing a lot of challenges. So in this is not a situation that we can afford another COVID outbreak, definitely not. So however, unfortunately, during last few days, there has been an increasing number of cases being reported.
Yes.
There were, on 28, there were 143 cases with 5 deaths that were officially reported. So there's some slight increase in the numbers, even though the numbers may not be very high compared to the past. I think we have to be very concerned about this because of the reason that we have mentioned. So I think if you take the realities of current situation, this decision to wear the mask and the recommendation to wear a mask, even though it might have been a little late to come, but still I suppose it's a good decision and a good recommendation, because in the current situation it's very difficult to recommend some of the measures like maintaining physical distancing. If you take the country's current situation with the public, the situation now, the status of the public transport, it's very difficult to advise people, or even if you advise, not practical. So in that case, we need to take as much as possible the different measures that we need to take. So one would be wearing the mask, and to the extent possible maintaining the physical hygiene and physical distancing if possible, and also vaccination, very, very important. Even though this is said to be a subvariant of Omicron, still it is shown that the vaccines are effective against them.
Yes, and Professor, now recently it was reported that the Pfizer vaccine stocks in Sri Lanka, the manufacturers themselves have issued a statement extending the shelf life. Speak to us about this situation. How important is it for people to get the second booster dose, that is the 4th vaccine?
Yeah, it's very important. It's very important because, as I have mentioned previously, the vaccine has shown to be effective. Similarly, previous infections also give some immunity. But what we notice nowadays is there is some increase in the number of cases. Can be due to many reasons.
Right.
One could be that now with the problems and the difficulties that people are having, they might lose the same kind of alertness that they had previously.
Right.
And similarly, the immunity also might be going down because it was some time ago that we had the previous dose. So it's very important that we use all the avenues or all the weapons that we have, so to say. So in that case, vaccine also remains a very important weapon in fighting this battle. And the vaccines have been shown to be effective. Even the variant has changed, it has been shown to effective. And up to now, the uptake of the fourth dose is still low. But one reason maybe that started only a few days ago. Up to now, about 18,000. It's very important that we take when it's available. Why not make use of it? There must have been some concerns about this notice regarding the extension of shelf life. However, that also it has been practiced in other countries also.
Right.
So, I mean, all what we can do is to go by the worldwide best practices.
Right, absolutely. Now, there is a certain shortage of certain essential drugs, certain life-saving drugs in Sri Lanka, and some hospitals have stopped conducting routine surgeries due to this. Is our medical sector coping or able to cope with the current situation, especially given the fact that we see how medical staff are also in fuel queues for days on end. We see how once they get petrol or diesel, the patients are unable to come to the hospitals because they are in their own queues, or they are unable to find public transport. So also the situation with the ambulances not having fuel. Although certain measures have been taken piecemeal, although we have donors, local and international, who provide these drugs which are in short supply, we don't see key decisions being made right at the center to address this dire medical sector crisis. How do you view this?
Yeah, as you mentioned very correctly, I mean, there are many aspects of it, and mainly the ramifications from the fuel issue or the forex issue, so to say, to start with, because that has ramifications in all the areas. As you mentioned, there have been shortages in several drugs, some life-saving drugs as well. There were critical shortages, and yes, I mean, donors have been supportive and they are trying to help. But on the other hand, the country's drug needs cannot be addressed completely by donors only. What they can do is just to help with the kind of bridging the situation, but not on a long-term basis. So that has been an issue. And in addition to that, I see far more serious issue because the health professionals and the health workers find it very difficult to kind of commute or the transport issue, because that has a lot of serious implications on maintaining the health system. And similarly, patients also find very difficult to come to the hospitals, so because their transport is not very much optimal, and public transport is also not in the best status at the moment. Is very much overcrowded, so they find it very difficult to come for their routine clinics. So that also has a lot of long-term impacts also. For example, maintaining or maybe managing the non-communicable diseases has become very challenging. And on the other hand, because of the challenges that people are facing on a daily basis, for example, waiting for days and days on fuel queues, so they might forget to take their routine drugs if they are on certain medications, and they might forget about hydration. So all these things we have even seen and heard about so many deaths happening in the queues. So there are so many areas. So all these has to be taken together.
How must the government of the day, the incumbent government, the Ministry of Health, these are the main stakeholders who are vested with the responsibility of looking after the people's health. It's in the constitution that looking after the citizens' health is it's a directive principle. There is a dereliction of duty by the state how must the state act, Professor?
Yeah, I think the priority of the state should be addressing the problems that people are facing. So, I mean, that should be the priority. More than anything, that should be the priority. So, if you take the fuel issue, and also in the future, I mean, there may be food shortages, so those areas has to be the immediate priorities rather than anything else. Because, I mean, otherwise, I mean, the suffering of the people who are undergoing those and waiting in fuel queues for days and days, and then difficulties in transport, logistics, all these things actually help. If you take the public health as a broader perspective, I mean, it is not only giving medicines. There are so many aspects of health, even mental health. I mean, people are undergoing tremendous stress. So all these areas actually health. All these areas has to be addressed together. So I mean, that is where the professional support also need to be enlisted, because there can be innovative methods in addressing those issues. For example, when it comes to the medication, I mean, there can be the rational use of medication and prescribing, things like that, and even the preventive measures. And when it comes
could you elaborate on that?
Yeah, for example, I mean, especially when there are drug shortages, then what are the essential drugs, and what are the drugs that, I mean, the same thing happened during the forex shortages in 1970s when Professor Senakvibili has implemented the rational medicines policy. So similar approaches, I mean, there are solutions, but for those solutions you need to get the support of the professionals in the country who are capable of doing that, and then to basically help the people to come out of these problems. It's very important.
Yes. Let's also talk a bit about the mental health aspect that you alluded to. At present in Sri Lanka, we see how the current crises have adversely impacted the mental health of not just the three-wheeler drivers and the bus drivers and the nurses and the doctors. We see the tension, the helplessness in the faces of every person that we meet. And it's so tragic. And a lot of these people have either no awareness or no access to proper mental health care. How must this mental health pandemic be addressed?
Again, very serious, because I mean, with the current situation, everyone, not only those who are in fuel queues, everyone, if you see the situation in those, it's very volatile, and everyone is basically on the edge, because people, they feel the gravity of the situation, the current situation, how serious it is. So young people are feeling that their future have been taken away, their hopes are lost. I mean, there is a hopelessness among them. And if you take the elderly people, they are very worried. Even during those last phases of their life, will they ever be able to come back into the life that they have been leading? So everyone feels very frustrated, disappointed, and very angry. So there need to be a way to express those feelings. That is where the freedom of expression has to be, which is enshrined in our constitution, has to be allowed, because that is one way of say venting out those frustrations. That's very, very important, I think. So those things has to be taken very seriously, because it's very important to look at the message and not the messenger. Because we are what the message that we are getting is everyone is feeling very frustrated. So those things has to be addressed. They had to be seen that the people's issues or the suffering that they are going through, there is an attempt, at least an attempt, to genuinely address them.
Do you see such an attempt?
Unfortunately not so. Unfortunately not so, because nowadays also what we see is kind of say to suppress the voices and concerns of the people. What we mostly see is basically trying to blame in the messenger, or try to put the blame on the people over the messenger, rather than to see what is the message. what are the root causes for this problem, this crisis? I mean, all these problems in health and food and nutrition, all these areas, there are root causes. So, I mean, still we don't see a genuine attempt to establish what people are asking. I mean, people are very frustrated. They are asking for good governance. They are asking for change in the system. They are asking for some hope. They are asking for some kind of sustainable measures. So people don't see that. So I think that is very, very important that the government take measures to show a genuine commitment, a real genuine commitment, at least as a step one towards establishing good governance, what people are asking. What people want to see is a genuine commitment.
What is the role of professionals in the current crisis? You've also been quite involved in several professionals movements such as Direction Sri Lanka, which issued several statements on the escalating crisis facing Sri Lanka and suggesting several reform areas, recommendations. As a professional, do you think that there is an over-reliance of sorts on the state? Of course, there has to be a proper state structure and a mechanism, a parliamentary democracy, all of that is there. But what is the role of the professional? Can't the professional get more involved in these processes?
Very correct. I mean, now sometimes I feel that professionals were waiting too long without getting really involved in supporting the country or the nation to basically and share their expertise, share their knowledge for a better country or a better nation. So I think even now, I mean, better late than never. Right. So there's a huge role. On one aspect, professionals can come out with, say, there can be various solutions for this current situation. For example, moving towards e-governance could be one area, because people are very worried about the corruption, very worried about the inefficiency. So areas like e-governance could be very important. Accountability, auditing, honesty. So all these areas, say, sustainable power and sustainable energy. So there are so many areas that professionals can contribute. I mean, one personal example may be again related to COVID. During COVID time, when the COVID crisis was there and so many people were dying, I mean, we as professional groups came together and came out with working with the Ministry of Health and all other bodies. We came out with a telemedicine system, which many may be aware. And we using that telemedicine system, we were able to sort out only the needy patients who need admission, so that the hospital load could be reduced. So there are measures actually. Yes. So the similar. And
it's not rocket science.
Exactly.
If a few people get together and come up with these concepts, it can be easily implemented.
Exactly. I mean, even if you apply the same thing into the fuel crisis, true that the amount that the country is receiving is not adequate for the needs. It's a fraction of the amount that is needed. But even that amount, if there are certain measures, that is where again if the e-governance comes in a way. I mean, this QR code system, even though there may be deficiencies, it's a good move actually. Sure. Because we saw when there was no system, there were a lot of malpractices. No, yeah. I mean, even the limited amount of fuel that people were getting, it was not distributed properly because the system was not there. So that is where the expertise should come in, introducing new systems, maybe simple systems that you can identify so that you can reduce those malpractices, even using system that can use maybe the registration number or the national ID number. You might be able to reduce some of the malpractices, and at least you can introduce some order into that. So all these possibilities are actually there. All these possibilities are there. That is where the professionals should come in. But having said that, we as professionals, we should not be expecting that just by professionals proposing that will be implemented. That is where the professionals need to get together and press for the solutions. Press for the solutions for the problems that people are facing, not only that, for the nation as well.
All right. Yeah. Fantastic. We are in conversation with Professor Indika Karunatilaka. We're going for a short commercial break. We'll be right back.
Covid-19 සඳහා ආරක්ෂිත පියවර. නිතරම හොඳින් සබන් යොදා දෑත් සෝදන්න. සබන් හෝ විස බීජ නාශක මධ්‍යසාරයක් භාවිතා කර දෑත් පිරිසිදු කරන්න. සෑම විටම අන් අය සමග මීටරයක දුරස්ථභාවයක් පවත්වා ගන්න. හැකි සෑම විටම නිවසේ රැඳී සිටින්න. නිරතුරුවම නිවැරදිව මුඛාවරණ පළඳින්න.
We must be prepared to face any challenge.
There is no quick fix, but we have to go for a solid fix.
Where do you think the Central Bank of Sri Lanka is heading right now?
Coming out of the ashes like a phoenix, we will rise. People are fighting for daily survival.
We have to restructure our debt, there is no doubt about it.
I rather try at my best, sitting with the enemy, trying to sort this out.
IMF is not the destination.
We've heard a lot of political parties over the years over-promising and under-delivering.
Face the Nation every Monday at 9:30 p.m. on TV1.
We're back with the People's Platform. How must Sri Lanka avert another medical crisis, another COVID outbreak? We're in conversation with Professor Indika Karnathilaka. Professor, you have a special interest in public health. Speak to us about the gap between the health sector on the one hand and the general public. There's a massive gap. Now, even if we go to a government hospital, and we see this a lot, I've personally experienced this. Some doctors, we have fantastic doctors, we have a fantastic medical system, but some doctors, what they do is they speak at the patients, they tell them, okay, these are the medications you need to take, this is the condition you have, and they're sent off. There is no dialogue between the doctor and the patient where the doctor sits and explains to the patient what's going on, where the patient tells the doctor what he or she is going through. So this gap is there, that is at an individual level, because that culture is not there. Whereas in more developed countries, we see this discourse taking place, so the patient is also quite comfortable. Exactly. And for this, we can possibly blame our education system, where it's very backward, people don't really question things. Now, my question to you is broader, in that I'm asking you, how must we increase people's literacy when it comes to health?
Okay, again, very important question. Yeah. Having said that, I mean, if you take public care, that's a very broad area, and treating patient is only one aspect of it. Yeah, and there's some of the issues that you are mentioning are probably there. There can be a lot of other practical reasons also, because most of our doctors, they actually do fantastic service. Absolutely. Even under really constraining circumstances. Sure. If you visit a OPD or a hospital, there are hundreds and hundreds of patients, so they might find it very difficult to find time to explain to them with the work pressure. Not only doctors, sure. All the health professions, they actually try to do their best for the patients. That humane nature, the Sri Lankans have that humane nature, so they want to help the patients at their best. That has happened in many areas. But having said that, definitely there are a lot of areas for improvement. The hospitals are overcrowded, so there need to be a proper referral system, where all the patients are not referred to one hospital. So and also the human resources in health, the doctors and health workers, they need to be distributed in an equitable manner, so that they will be serving the other hospitals also. Right. So there are a lot of changes that need to be made. Yeah, but that is one area. If you take public health, there are no excuses. Public health is basically dealing with public. It's all about empowering the public. Health promotion, public health is all about empowering the public. That is where we as health professionals have to really go deep into the community. Right. Very in-depth conversation, dialogue, That's very, very important. I mean, Sri Lankan health workers have been fantastic, actually. I mean, not only doctors, all the health workers, including public health midwives, so on and so forth, they have, over decades, they have helped this nation to basically come up to the top rankings and even comparable with developed countries. But unfortunately, even those are under threat in the current situation. So it's a very sad situation. Having said that, yes, we have a lot of role. I mean, if you take the, say, health promotion, you have to really talk to the people, advise them, because we have to change their behavior. Change in behavior cannot be done without spending a lot of time with them. So that in that case, public health professionals have a lot of responsibilities. But if you expand beyond that, I suppose all the professionals, I think now it's time for us to get down from our pedestals. We need to reach out to people. We have to reach out to people, talk to them, empower them, not only on technical matters. Technical matters are important because when the policy decisions are taken, people's opinion is very important. So you have to empower them on technical matters. Then only they will be able to argue and even say protest in an empowered way.
Yes, so you're saying instead of just having a top-down approach, it has to come from the grassroots level.
Exactly. I mean, ultimately it's people. Ultimately people nowadays. So vast majority are the people who are suffering. I mean, they don't have any political affiliations. They don't belong to, over 90% of people, they don't belong to any political affiliation.
They have genuine grievances.
They have genuine grievances. I mean, they are suffering. That's why people are coming forward. That's why people are voicing their concerns. Those are the people that as professionals we should be targeting. We need to empower them. We have to show them what's the pathway, what are the solutions available, what are the solutions that they should be asking for. The political literacy, very, very important. Because, I mean, ultimately it's the people. It matters.
Absolutely. Professor Karunatilaka, let's talk about your role in Direction Sri Lanka. It's a group of independent professionals. There were several strongly worded statements issued by this professional think tank. How important is it for us to now go in for constitutional amendments, go in for elections? How expeditiously must these be done?
Yeah, actually it's a very positive thing that the several professional groups are forming. Direction Sri Lanka is one group where it started with a group of doctors and lawyers, and now there are several other professionals coming in. And similarly, there's a group of senior doctors coming together. So professionals coming together, not for any personal benefit. I think it's a very, very positive sign. And without being biased to any political party, but they want the best for the nation. So it's a very good thing. And one advantage of professions coming together is then you can come out with a very strong conceptual framework. What should be the direction that the country should be going? I mean, rather than going for slogans or individual slogans, I mean, what should be the direction? That is why we are arguing that we need constitutional amendment. There need to be more independent commissions coming in. I mean, basically, the power should not be concentrated on one group of people or one person. It has to be the people's power. It has to be the professionals' power. That's why the Direction Sri Lanka and the other groups like the senior doctors, they are arguing for independent commissions. Correct 21st Amendment. So those are the areas, because I mean you might argue these are not areas for doctors, but on the other hand, public health is all about people's welfare, people's well-being. So in a broader perspective. So I'm very happy that professionals have come forward and coming out with proposals. So I hope that the government will listen to them and take proactive and positive measures on that.
Because of this crisis, something that came to our realization finally, just like a eureka moment, was the fact that there's a massive confidence gap in our policymakers. When you look at your parliament, you need to feel confidence that your best interests will be their priority. However, and recently I was watching some old footage which had resurfaced and was making its rounds on social media of a parliamentarian, and this was some old footage, destroying public property, and it was just so shocking to watch. So this is the caliber of parliamentarians that by and large we have. Yes, we have some fantastic people as well, but Sri Lankans deserve to have policymakers who are conscionable, who care about the country, who care about their people. So conscionability, education, vision, all of these are necessary, and I think this gap is now being filled by this convergence of professionals.
Yeah, okay. I would say, I mean, the professional's role is actually, I don't think the professional's role is to basically to take over the state power or get into the parliament.
Absolutely.
Probably not. No.
But
I mean,
it should be in complementarity.
It should be in complementarity with the legislature. That's how it should be. I mean, the profession should provide work. They should work hand in hand with the legislature, and the legislature should listen to them.
Yes, because we see a parliament. We have seen parliaments where the level of knowledge is lacking by and large. So then they need to be of the mindset that they're willing to act in consultation with experts, area experts. We see how sometimes Sri Lanka has gone and signed agreements with other countries, and the contracts haven't been looked at. And for example, some contracts don't have a termination clause, and then we end up paying millions of dollars as compensation or damages, which is terrible. These are very basic mistakes. So that role of the professional coming into the system has to be there.
Very, very important. I mean, having said that, I mean, there have been brilliant parliamentarians also, I mean, with proper knowledge, proper technical knowledge, and a very good reading of the situation, but unfortunately they are the rarity, not the majority. So professionals, what I mean, again, you mentioned about the knowledge. It's not only the knowledge, there is a competency also.
Right.
The and also the ability to get advice from the correct people is also a competency. That's very important. Sometimes that can be prevented maybe because of the ignorance, because of the ego, or because of the biases. So I think those are the things that if the politicians can move away from those, and then work hand in hand with professionals, I think we can basically salvage this country.
Okay, fantastic. Let's get back to resolving this medical crisis, Doctor, because I think it's one of the priorities also of the medical professionals in Sri Lanka. Speak to us about the avenues that we have to collaborate with other international agencies to find solutions at policy level and practically also.
Yeah, actually one good thing about Sri Lanka is Sri Lanka's health system has been well established. Oh, so many decades has been very well established, and even the preventive sector, curative sector has been established. So we can at least leverage that strong foundation, even though at the moment the system is collapsing, maybe so to say, we have a very strong foundation. And areas like, say, we have been working in very close collaboration with the World Health Organization. And other UN agencies. So I think it's very important we re-establish or strengthen those, because they are there to help. They are always there to help. So we need to get their support, and also go for very strong policies, like, say, like I have mentioned, very strong essential medicines policy is very important at this moment.
Because can you elaborate on that?
Okay, yeah. For example, with the current forex shortage, the drugs are very limited. So we need to identify what are the essential medicines that we need at the moment, and basically
that hasn't been done yet.
No, it has been done. It has been done. I mean, the essential medicines policy was introduced long ago during Professor Senaquibile's time, but it has to be now. It has to be followed to the letter. Yeah. For example, when it comes to the purchasing drugs, and when it comes to the prescribing or storage, transport, all these areas, the essential medicines policy has to be followed to the very letter. So in that way, we should be able to manage even with the limited amount of the medicines that we have. Similarly, health promotion plays a huge role, and the nutrition, especially with the possible crisis that we are going to face related to the food shortages, so on and so forth. So again, the how to get proper nutrition in these kind of situations, and disease prevention is very, very important. And even in a crisis situation, I mean, say for example, when you are staying in the fuel queue, how not to forget your routine medications, how to maintain your hydration. So those simple advices play a huge role. Disease prevention is the way to go.
Right. Finally, final 2 minutes of our show. Could you reiterate the importance of practicing mask discipline and the importance of getting vaccinated, and finally the fact that COVID is still amidst us?
Yeah, so again, it's a matter of getting back to the basics. I mean, how the COVID situation was controlled was by getting back to the simple basics, not by admitting everyone to the hospitals and treating them in ICUs. It's not going to work. So again, it's a matter of basics, and since with the current challenging situation, you need to basically use all the protection that is available. So that is why the mask is important, that is why the vaccination is important, that is why, very importantly, if you get the symptoms, very, very important, if you get the symptoms, if possible, get tested. But if you have suspicion, stay at home. And rest is very, very important, very crucial, not only for COVID, all the influenzas that are spreading at the moment, and even other similar diseases. Resting is very important. That could be the lifesaver. If you have symptoms, don't go on crowded public transport, don't exert yourself, maintain good hydration, good rest well, majority will be okay. But if you have, say, risk factors like the elderly or other diseases, then you have to be extra careful. So I think it's getting back to the basics.
Okay, fantastic. Thanks so much, Professor Indika Karunatilaka. Thank you for joining us on tonight's edition of the People's Platform. We'll see you again on Monday with the Sinhalese edition of the People's Platform. Thank you for watching us. Have a safe weekend. Good night.